Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Uzair Ahmed. Today's lecture is intended for 4th year BDS. Today we're going to start with maxillomandibular relationships. We will see how many lectures it will be in how many lectures it will be completed. Today we will try to finish the vertical jaw relations, or maybe the vertical jaw relations be completed in 2 lectures instead of 1. So starting off with the introduction of jaw relation records. Jaw relations are basically any spatial relationship of the maxilla to the mandible, and the main thing to understand is that there are infinite relationships of the mandible to the maxilla. We try to record some of them, but we cannot basically replicate all the possible maxillomandibular relationships. And these are some of the introductory pictures of maxilla and mandible. So the first step of jaw relation records, basically this topic is partly delivered in lecture rooms, and a major portion of this topic is basically delivered in clinical rotations in with live patients. So we will try to cover as many things as possible in this topic, and inshallah the remaining things will be taught over the live patients. The first step before jaw relation record is occlusal rims. Their try-in, we have to understand that at this stage the student has recorded the secondary impression. The final base plate has been formed over the final master cast, and then the occlusal rims has been fabricated over the plates. So after that, before jaw relation records, the occlusal rims try-in is done, and in this procedure, first there is inspection of occlusal rims. So this is the map of jaw relation appointment that we will be going through with the patient. First there is inspection of occlusal rims, then there is establishment of labial form of the occlusal rims, then the establishment of occlusal plane, then there is establishment of vertical jaw relation, then there is faceboard transfer orientation relation records, and then the last step is establishing and recording of centric jaw relations. At that time the maxilla and mandible occlusal rims are joined to each other and are then removed from the patient's mouth and are transferred to the articulator. So this is the maxillary occlusal rim over the base plate, and this is the mandibular occlusal rim over the base plate. We have to, during try-in, we have to check the record basis interferences and the patient's comfort. After that, the second step is establishing the labial form of occlusal rims. This step basically is dependent on the dentist's ability to evaluate the aesthetics of the patient. Here you can see that the patient has been inserted with maxillary occlusal rim, and we can see that there is labial fullness of the patient. The anatomical and the aesthetically this does not look accurate or optimum. So there is either one of the three situations. This is the which is visible here is the labial fullness. Either there will be a labial fullness, or there will be a deepening of the labial lip form, or there will be optimum aesthetics of the patient. We will see here that To establish the anterior posterior position of anterior teeth and aesthetics of lips and face. First, some of the guidelines that basically this step is subjective in nature. It's dependent on the dentist's ability to evaluate the aesthetics. So the first guide is facial aesthetics, and then there is phonetics guidelines as well. During facial aesthetics, following landmarks are used: fullness of upper lip, that we just saw in the previous picture, the philtrum, the nasolabial fold, and the commissures of the mouth. Fullness of the lips: if there is inadequate support by the occlusal rim, the upper lip looks flabby and unsupported. Also, there is deepening of nasolabial fold. The facial creases will appear deeper, loss of prominence of philtrum, and drooping of the commissures of the mouth. So the correction of this, in case of inadequate support, the correction is done by adding more wax. Or in another situation, if there is an excessive fullness or excessive thickness of the labial portion of the jaw of the wax rim, there will be stretched face. The philtrum appears narrow or shallow, nasolabial fold appears smooth, and corners of mouth appear stretched. This problem, the correction of this problem is done by removing the wax. The philtrum, we can see that philtrum is too forward or stretched, the rim is too much inclined, and the labial flange is too much thick. I hope there is a picture here. This is basically a philtrum area. So you have to look here that if there is stretched or fall forward, the rim is too much inclined, the labial flange is too much thick. So this is the what we call as a nasolabial fold, these two areas. So how can we check if there is excessive or inadequate fullness of the lips? The nasolabial fold appear filled out or almost invisible when the rims are too far forward. In this case, in which there is there does not appear any nasolabial fold, which means that the labial portion of the occlusal rim might be too thick. Incisor visibility is basically the establishing the height of anterior portion of the occlusal rim, and it also establishes the superior inferior position of the anterior teeth. We will see how the governing factors are basically the incisor visibility and length of the upper lip. Here we can see that in a natural dentition, the position of upper lip is somehow that all of the anterior teeth, maxillary interior teeth, plus portion of the gingiva is also visible, which is called the high smile line. And in this case, all of the maxillary anterior teeth are visible, but there is no visibility of gingival area, which is called as low smile line or a lip line. A lip line is basically a height of the upper lip relative to maxillary central incisors. In high lip line, we have medium lip line, we have low lip line, or we have anterior low lip line as the three different types. These can be different situations we can observe in natural dentitions. Here what we see is after insertion of the occlusal rim, there is too much incisal show when the patient smiles. So if this is the situation, the the height of the occlusal rim is reduced so that there is 2 millimeter of incisal show during rest. The patient is not smiling. The patient is at physiological rest position, and 2 millimeter of occlusal rim, maxillary occlusal rim, is visible. This is considered the optimum height of the occlusal rims. Second step after establishment of the aesthetics and phonetics and the labial position of the occlusal limb is the establishment of occlusal plane. Basically, occlusal plane is an imaginary surface which is related anatomically to the cranium and which theoretically touches the incisal edge of the incisors and tipping of the occluding surfaces of posterior teeth, like this. This is the mandibular occlusal plane. Which are the lines connecting tips of the incisors and the distobuccal cusps of the most posterior teeth on the both sides of the arch. Occlusal plane basically it departs from a straight line and assumes a curvature upward posteriorly in the direction of glenoid fossa. The students must remember at this point that we have discussed the concepts of curve of Spee and curve of Wilson, which are also curves which define the occlusal planes of natural dentition. From one canine to the other canine, the region is made parallel to the interpupillary line in the anterior region, and the plane is nearly parallel to the Kemper's line or ala tragus line in the posterior region. This is the step of establishing the occlusal plane during occlusal rims. The anterior portion of the occlusal plane is made parallel to the interpupillary line, and the posterior plane is made parallel to the Kemper's line. Kemper's line basically extends from the upper part of the tragus to the lower part of ala of the nose. And how this is established is with the help of a specific I'm sorry, this app just keeps crashing. Just a second. So where were we? So the posterior part of the occlusal plane, it is made parallel to the Kemper's line. All of this is made possible with the help of a specific instrument which is called Fox's plane. Most of you should be familiar with Fox's plane at this point. The anterior and posterior both planes are made parallel with the help of this instrument. Both the anterior and posterior planes are checked. Here you can see that the interpupillary line is not parallel, and this is how we check the posterior occlusal plane. The pictures are very much self-explanatory at this point. So another option to establish the occlusal plane is with the help of establishing the mandibular occlusal plane first. In this procedure, the anterior height of the anterior part of the is adjusted to the level of corner of the mouth. And the 0.5 millimeter of anterior portion of the occlusal rim should be visible when the jaws are at rest and lips slightly apart. The posterior height is adjusted by having the rim that should end at the junction of upper one third and lower two third of retromolar pad. Once the occlusal rim is established, the upper occlusal rim is adjusted so that there is an interincisal rest space of 2 to 4 millimeter. After establishment of occlusal plane and anterior aesthetics, then comes the maxillomandibular records. There are three types of jaw relation records: the vertical jaw relation, the horizontal jaw relation, and the orientation jaw relation. In the orientation jaw relation, we either record the arbitrary or the actual one. Most commonly recorded ones are the arbitrary ones. In vertical jaw relations, we record the vertical relations at rest and at occlusal vertical dimensions. And in the horizontal jaw relations, we record centric and eccentric records. So, I think the vertical jaw relation will be covered in the next lecture. We can, I can maybe give you some of the preview of. So yeah, there are different types with the rest vertical dimension, the occlusal vertical dimension, and the interocclusal dimensions, or freeway space or rest space. So this will be covered inshallah in the next lecture. Thank you so much at this point.